Hi, I'm Christopher Westfall. I specialize in the world of insurance for seniors. I'm a licensed insurance broker in over 46 states. Today I want to talk about what happens when you're on a Medicare Advantage plan. What do you need to look out for? What are some things that some people don't know until they experience them and then it becomes too late? And are there things that you can do to prevent financial catastrophe potentially happening to you, or a limit on choices that may affect your overall health while you're enjoying a Medicare Advantage plan? So first of all, there are two important considerations. There are probably more. Today I want to focus on these two because we see these the most often. And if we can take an ounce of prevention at the beginning when you're on a Medicare Advantage plan to address these, if you can, and not everyone can, as I'll discuss in just a minute. If you can do that, it will give you two things. First of all, financial security, and secondly, peace of mind. That's what we instill in our clients, because we want them to have peace of mind so that then when they've made the decision, they've done the best thing that they can possibly do for their health, for their budget, for everything. So sometimes we help people with Medicare Advantage plans. Sometimes we help people with Medicare supplement plans. It depends really on their specific situation, their health, their background, if they're a frequent flyer or not. That means somebody goes to the doctor a lot in my world. So typically when we're talking about Medicare Advantage and the considerations, we're talking about the most restrictive type of Medicare Advantage, which also happens to be the one that the majority of seniors are on. According to the Kaiser Family Foundation, more than 2/3 of the people are on a Medicare Advantage HMO. The HMO is a health maintenance organization. They maintain your health, and they do so to try to keep the cost low. And in doing so, there are a couple of things where we feel like there are some holes, only because we've seen this. We've experienced it with our own clients that have been on Medicare Advantage. In here, we hear stories every day of people who were not prepared. They were not adequately schooled on the fact that there was this gaping hole on their coverage. And if you look very carefully at your summary of benefits or your annual notice of change to see what last year or this year may be the same, look closely at these two things, because these two things will draw your attention to the fact that this may be an exposure to you as well. And again, we're going to talk about some ways you could take care of that. So you're on a Medicare Advantage plan. What do I need to look out for? The first one is cancer. So cancer is so prevalent today. There's a big difference, though, in how cancer can be treated, the choices that can be made, the course of treatment, the costs that go allocated towards your care inside of an HMO, as opposed to inside an indemnity policy that's going to just pay the bills. I'm not trying to sound an alarm with anybody here. I want you to understand that. I'm not trying to tell you, you're going to get cancer, so you got to go buy some insurance. You got to buy something extra. You don't. I just want you to be aware of it, because I'm in the risk management business. It's like the guy who insures your home. He should be telling you about earthquakes and flood insurance and wind damage and all the other stuff. Should be going over that with you just so that you're prepared, and you can't come back later saying, well, you didn't tell me it had this big gaping hole in my policy. That's kind of my job. So as most people are on Medicare Advantage HMOs, I think it's critically important to look down into your benefits, and you can see this in your benefits, and see to what extent chemotherapy is covered on your plan. You may be surprised to find that the majority of plans out there, again in the HMO arena, will cover 80% of your chemotherapy treatment while you're on the plan. That's going into the doctor, getting hooked up to the IV, all the rest. That's treatment in a setting, in a doctor or hospital setting for chemo. If they're covering 80%, what are you going to use to cover the other 20%? This is not like original Medicare, which covers 80% of Part B costs, which is the outpatient things on original Medicare. But then people couple with that original Medicare whole of the 20% a Medicare supplement. That's not possible for everybody. So if you're on a Medicare Advantage plan thinking it's going to cover everything that Part A and Part B does, in this case, it does. It covers what Part B would have covered. Assuming you're going inside the network and inside their rules and everything, they're going to cover what Part B would have and not a dollar more, which means 80% of the chemo. So again, you're not with a supplement now, you're with an Advantage plan HMO, and you've got to find a way, first of all, to pay for that, and then to open up other doors too, like what other things could you cover if you had unlimited funds. That's what we want to look at, is freeing up some other funds for it. I'm going to take a look real quick. This is from cancer.org. You can go find it. This is the incidence of cancer from just everybody in society, just looking at everyone, just a blank slate. So birth to 49 years old, that's going to be 1 in 30 men and 1 in 18 women are going to develop some kind of invasive cancer. As we get older, now we're coming into our Medicare population. So 65 to 69 is going to be the high end of this. This is saying 1 in 8. And again, if you restrict this to 65 plus, look where the trend then goes. 70 and over, men are going to get an invasive type of cancer in 1 out of 3 cases. Women, 1 out of 4. This is not Chris Westfall scaring people into getting cancer, trying to buy or sell you more insurance. I'm looking at facts. I went right to the source so that you can be more prepared. Please understand that. So all of life, you have a 1 in 3 chance for men, 1 in 3 chance for women. You'll see then that they are focused primarily on the senior ages, as this is where we have a huge spike in the, and you can see the different types of cancer that you're most prone to, but in stats you learn you have to add all these things up in probabilities, and it just comes down to this. Men 1 in 3 Medicare age, women 1 in 4. So what can you do for this? Well, real quickly, I found a doctor that put out an educational series, and he's talking about the differences of cancer treatment options. Please pay very close attention to what he talks about, the differences of having like an indemnity type policy versus having an HMO where they're managing the cost and so forth, because it's very pertinent to this conversation right here. I'm just going to break away from the screen right here and show you Dr. Scholes.
Hi, I'm Dr. Scholes. A common question we get at the PCRI is, does insurance affect the quality of your medical care? The answer is, it certainly can if you have certain types of illnesses. When we talk about the different types of insurances, we're talking about prepaid or HMO insurance, private or PPO insurances, or Medicare, which functions in many ways like a private insurance. So what's the difference? Well, of course, the HMO insurances are really insurance companies that employ physicians, and they're always trying to cut costs. I find that HMO insurances are good, certainly to save money. They're pretty solid on the common everyday illnesses like childbirth or appendectomies or high blood pressure and this sort of thing. And they've been very popular because they are more economical. Where HMO insurances tend to fall short is when people come down with a complex illness like cancer. And I'm a prostate cancer specialist, so I see the dichotomy of the way people with HMO insurance are treated and the way people that have private insurance are treated. And there's a big difference. The people who have private insurance have a lot more discretion on choosing their doctors. The treatments are generally better funded, and there's just broader access to better care. So I mentioned that Medicare functions sort of like private insurance, but many people do sign their Medicare over to become a sort of an HMO insurance. They'll get some additional benefits for drug coverage and whatnot. But once again, they will be restricted in the physicians that they can see, and you'll need pre-approval for perhaps some of the more expensive treatments, whereas with general Medicare, your doctors and you will have a broader free discretion about what kind of treatments you get. So there's a lot of choices out there, and in particular in prostate cancer, because the majority of men are over age 65. This choice between getting a prepaid Medicare type HMO versus holding on to your regular Medicare could make a difference in the quality of care that you can access with relative ease, as opposed to having to fight your insurance company to get the treatment you want.
Okay, so that's not Chris Westfall. That's a doctor that specializes in cancer treatment, and the point in showing you that is just to back up what I've been saying in this whole video series, and also to point out the fact that there are always give and takes. There's choices that we have to make, and a lot of those choices are driven by how much money we've saved through our working lives, and then what our choices are later as far as what we can do with healthcare. That's just life. And so for our clients who have chosen a Medicare Advantage plan, we want to let them know that there will be a difference in the choices available to them, maybe even the quality of care, and certainly the out-of-pocket cost if they go Medicare Advantage versus Medicare Supplement. What can you do about that? Is there anything you can do about that? Yes, there is. First of all, cancer insurance is available. This is not very expensive, and what we're talking about is a first dollar indemnity type, paid upon diagnosis, cash lump sum cancer plan. I've got one for myself. So if I get diagnosed with cancer, I'm going to get a check for $25,000 from an insurance company. All they need is proof of the diagnosis. That's it. What am I going to do with that? Well, in my health plan, it's a $6,000 deductible, and then there's co-payments, and then there's a network restriction. What if I want to go to a very special hospital that's not part of my network, similar to this situation here? I can then have the funds based on the insurance company, based on a very small premium I'm paying every month, to have that choice, that freedom, that flexibility. Now, can everyone get a cancer insurance policy? No, you can't. They're going to ask questions like, have you had cancer in the last 5 years? If you have, you can't get it. They're going to ask, have you ever had leukemia? They're going to ask if you've got some other conditions that lend themselves to being prone to cancer. It's not as extensive underwriting process as it is going through like a Medicare supplement transition outside of open enrollment, but it is a very limited in scope focus on your proximity to cancer. Doesn't ask you about your genes or your family, your relatives, or your likelihood of getting cancer. It's looking just at you, and it's asking, the biggest question is, have you had cancer, HIV and AIDS and all that, in the last 5 years? So that may be a good choice, and we're talking a cancer policy somewhere in the range of $20, $40 a month to provide between $10,000 and $25,000 typically of flat rate, immediately available cash, so that you then are in the driver's seat, not only to afford yourself to new cancer treatment options that may not be approved or available within the network, but heck, just to pay the other 20% of what could be the cancer treatment costs if you do go in the network, if you do play by the rules, if you do everything that they tell you to do. 20% exposure to a very significant cost is a lot. Some of the Medicare Advantage plans, like the ones around here, only have a maximum out of pocket of $3,400 a year. That's wonderful. But most of the seniors that I know, if they get a diagnosis and they're hitting that maximum out of pocket late third quarter, late fourth quarter of the year, and they're going into the next year, that maximum out of pocket ceiling on the Medicare Advantage plan resets every January 1. So you could, even with a $3,400 MOOP, as they call it, go from 1 year to the next and then have to pay $7,000 in your max out of pocket for a treatment like this. This is when we see people hit their MOOP, their maximum out of pocket. This is when we see it. So the other thing that you need to do to just consider, I mean, especially if you're on a Medicare Advantage plan where you've got a 0 monthly premium, it's not too much in most cases for someone to consider coverage like this for something that is such a big hole. And again, look at your specific plan, look at your summary of benefits, and see to what extent everything's covered if you follow the rules 100%. If every course of treatment that you need in there is approved, that's the best case scenario, what you're going to see in your summary of benefits. And I believe that what you'll continue to find is that they're going to do the bare minimum on those plans and cover what Part B would have covered absent a supplement. And remember, if you get a Medicare Advantage plan, a 0 premium plan, you can't go then buy a supplement. You certainly can't go buy a supplement if you were diagnosed with something. Then it's too late. That's kind of like getting insurance on your house once your house is on fire or underwater. It doesn't work that way. All the insurance that you're going to get has to be purchased before you have the claim, before you have the need for it. And cancer's no different. Incidentally, for my folks that live in California, California's got kind of a goofy rule there. We can't find any cancer insurance that's available on the market. If you know of one that's available, please let me know, for anyone that can purchase it after the age of 65. And everyone that we've looked at, and it may be the state law there specific to what's available to be sold, probably because of their hostility toward insurance regulation, you can't buy a cancer plan past age 64. So if you're considering getting on a Medicare Advantage plan in California when you turn 65, it is far more advantageous for you as a 64-year-old to buy yourself a critical illness policy and or a cancer insurance policy, because once you have it, you can keep it, but you can't buy it after the age of 65 in the state of California. I could be wrong about that, and if I am, I'll update this video later. But that's everything we've looked at. All the companies that we've ever worked with in the state of California can't sell it at 65 or over. You have to have purchased it before you turn 65. Again, that's just California. What else can you do? You really need to read up on the appeals process. As I've covered many times and in depth, the Office of Inspector General for Health and Human Services did an exhaustive study where they looked at all these Medicare Advantage plans and found a systematic denial of pre-authorizations when it came to expensive care. I'm not saying that's going to happen in your case. Not even all plans have pre-authorizations for all kinds of care or hospitalization. What I am saying is you need to know your plan. You need to know your appeals process. Who do you call? Who do you write? Hopefully you'll have a healthcare advocate for you if this happens, where somebody can just be with you in the hospital. Somebody can be your advocate to fight for the insurance company when maybe you're trying to do this from a bed where you're sick and you can't do it because you don't have the energy. The best treatment anybody gets in a hospital is when they have somebody there raising holy hell if it's going south. And you probably know exactly what I mean if you're on Medicare. You've seen this before in the insurance world. What's the other thing? Hospital cost itself. So we've seen companies that have as high as, actually, do I have one right here? Let me see. I think I've just got one. Yeah, I do. I've got an example from our backyard right here in South Carolina. I won't go over the name, but I'll zoom in on it. So this is an example of a typical Medicare Advantage plan where it's got a hospital inpatient coverage that costs $275 a day for days 1 through 8. So what does that add up to if I bring out my handy dandy calculator? That's 8 days, right? Potential 8 days times 275. 8 times 275. 8 times 275. There we go. Oh, that's only $2,200 to go into the hospital on an 8-day stay. That's not a big deal. Oh, but wait, if you go in by ambulance, there's another $275. Somebody just add that plus $275. So that's $2,475 for the hospital. Services like MRI could be up to $225. Limits apply. You better get that pre-authorized. But outpatient x-rays are $0. That's really great. And if you go to the emergency room, that's another $120. Let's say you go from the ambulance into the emergency room, then you're admitted. So you could be over, well, you could hit your maximum out of pocket there pretty soon. Anyway, the point is that's not unique to South Carolina. It's not unique to this particular plan. It's the hospital cost that is of concern. What can you do about it? Well, let's first look at the incidence of what's the likelihood of that I'm going to be hospitalized anyway. This comes from the Center for Disease Control, yeah, CDC, the government, and you can go to the URL right down there and see all of it. But if you're looking at all males, all females, looking at everyone, what is the incidence of someone being hospitalized? Oh, look, all the youngsters, we have it right here. You have the highest probability, 10.7% chance every 12 months of going into the hospital if you're 65 and over. 10.7%. That's interesting. To go into the hospital twice, it's very, very low, 2.7%. 3 or more times is 1.9%. But it's just interesting that very low incident of hospitalization until we hit the senior years, until we hit the Medicare years. And then it's 10.7%. It's very likely. So what can you do about that? They do have a hospital indemnity policy, which again runs in the range of $20 to $50 per month, and they can match exactly what your hospital daily cost would be that you have to pay all at once if you were to go into the hospital. So you can select a benefit of $200 per day for 5 days, $300 a day for 7 days, $500 a day for 10 days. And the only trigger is that you went in the hospital. Now, the good plans will also cover you if you're just not even admitted, but you're in there under observation status only. That's the big thing that they're doing right now. It's a big fight in Congress. NAHU, that I'm a part of, been trying to fight this so that the hospitals will understand that it messes people up if you're just keeping them in observation status when they can't trigger the benefits of their plan. Anyway, that's a topic for another day. But you also have to know that there is insurance specific for covering a hospital admission, and it's separate and aside from, and they don't pay the hospital, they pay you directly. So maybe you did have $2,200 laying around, and it's not going to hurt you at all. The cash coming from the insurance company could just replenish your supply. And again, if you're on a zero premium Medicare Advantage HMO plan with its inherent good things and bad things, one thing that you might be able to afford is something like a hospital indemnity plan that will pay your hospital cost, your daily amount, or at least some of it, or half of it, or whatever you could afford, so that your $20 or $40 a month will take care of not having to pay at $1,000, $1,500, $2,000, $2,200 hospital admission stay. Again, there are qualifications to that. Not everybody can qualify. They're going to ask if you've been in the hospital in the last few years, what it was for. They might even ask what drugs you're taking, what major conditions that you have that are lending themselves to a hospital stay. There are some companies out there, this is really neat, that as you're turning 65, they will make the hospital indemnity policy guarantee issue for you. Some for 6 months, some for a year, because this is all discretionary on the private insurance company. This is a separate private policy. So if you're turning 65 and you're considering a Medicare Advantage plan, not only would the rates be the lowest possible in these types of policies because you're 64, but you're guaranteed to get that plan issued without any evidence of insurability or health questions or pre-existing conditions. That's pretty cool. We have a lot of companies that offer that, and it could be something worth looking into. Again, everyone should read up on their appeals process about hospitalization. Make sure you understand that if they're trying to get you out of that hospital quick, because they're trying to manage the care, manage the dollars of your care, your doctor needs to be the first line of defense that's going to try to advocate for you. Doctors say all the time, and I've got videos of doctors talking about this, it's frustrating for them to try to get the pre-authorizations, the appeals, all this stuff. They spend way too much time dealing with insurance HMOs trying to get this stuff done, but hopefully they're your first line of defense, and someone can help you through the appeals process. But you need to, before you need it, you need to know what the process is. So I hope some of this has been of value to you. Again, the big gaping holes of going into an HMO that you need to cover, because not everyone, obviously, is going to be able to stay on original Medicare or get a Medicare supplement. I understand that. So if you're going to be in a Medicare Advantage plan, what now? Look into cancer coverage, only because it's such a high incidence that it's happening. The cost is tremendous. It's through the roof. You're going to hit your maximum out of pocket. And I would prefer that my clients have an insurance company pay that so they can focus on getting better and not focus on paying more bills. So anyway, I hope this has been of value to you. If so, would you please drop a like down below? Click that thumbs up button. Please make sure to subscribe for more updates and tips and tricks about how to deal with the life on Medicare. We have future things coming that I think you'll find interesting. My name is Chris Westfall. Thank you so much for watching. God bless you and have a great day. Bye-bye.